There you guys, sorry, I just clicked record. We still have about 2 more minutes, but I wanted to hop on a little bit early again because we do have some new members. So I just wanted to make sure that they could log in okay. I'm super excited about this session today actually because I worked hard to come up with some hard mock exam questions for you. So I hope that you guys like it. You will notice 3 of my dogs behind me. They're just taking it easy right now. I'm seeing a lot of patients this weekend, so I was just packing up for that because I'm going to, where am I going this weekend? Woodstock and Stratford and London. So I'll be all over the place. Yes, I have been working a ton and I'm so happy though. I will probably take off Monday though, just because I'm kind of noticing that I'm starting to get sore, which is the nature of our occupation, right? But I've just been trying to see as many people as possible because I do have patients that want to be seen. But remember, we have to take care of ourselves too, right? Yes, I know. Even here, a lot of dental offices aren't fully open yet because there's just not enough PPE to go around. I have enough, but I won't have enough forever though. So I'm really hoping that in a month or so, things start to calm down so that I can actually order more, because then I might have to say, now my PPE has run out, I can't see any more patients. Sorry guys, my one dog needs to get out. I'll be right back. There, guys, sorry. You guys probably saw my lovely pajama pants, which is funny. That was not intentional. I just realized I forgot to change my pants as soon as I clicked, let's start the session. So that's what happens when you guys work from home, okay? Yeah, I know. Thank you. I'm so happy that you like them. Okay, guys, so 10 o'clock. Are you guys excited? Are there any questions, though, from our previous session last week? What do you guys think? No? What did we do last week? Oh my goodness, that's funny. We did a special needs lecture, right? I kind of forget too. No, we must have. Yes, we did a special needs lecture because I did say we would continue on with our session today and do mock exam questions now. And then this means that we can move on to a whole other topic. Before I forget, I did want to mention our next few sessions will probably be the evening time, because when I was asking students if they preferred the evening or the morning, a lot of students did say the morning, which is why which is why I scheduled some for the morning. But those students that said that they could come, they're not here, and they weren't here the past few times. So I want to switch it to the evenings now and just see if that's I guess better for everybody. So I'll post our sessions under the events tab. I am just working out my schedule with all of my patients, but the next 2 sessions will be Friday evenings at 5 p.m. So I do hope that that's easier for everybody. Yes, I do always have them recorded. It can be a couple hours for the recordings to come up, but you'll see the recordings in our Facebook group, and you'll also see them in the 2020 Dentalelle sessions on YouTube. So definitely check that out. If you're ever looking for something, do a search in the group we have on Facebook, and then you can find it, because I do get questions about where our playlist is. All you have to do is do a search for, like, let's say 2020 playlist, and it will pop up right there. So it's super duper easy. Sam, hello. Missy, hello. Hi, you guys. Yes, we have not started yet. I'm just about to. Can everybody see my screen? I should ask first. Can everybody see my screen okay? Yes, perfect. Okay, good. Let's see here. Okay, and there's no questions from our session from last time, is there? It was kind of just a lot of special needs, basically. We did talk a little bit about ethics, but now we are doing mock exam questions. So the first, actually, I would say 14 slides. These questions I've gone through before. So if you're a new student, you have not seen them yet. If you've been with me for, let's say, 6 months, you might have seen them, but they were very, very tricky. So I want to go over them again because a lot of people got them wrong. So if you guys are new with us, we haven't done a mock exam session for, I think, a couple weeks. I have the questions here for you. If you guys don't mind typing in the chat box what your answers are, I'm the only one who can see the chat box, so nobody else will see your answers. I just kind of like to see where everybody stands. Now, you guys, do I need to change the color? Is this too light for you? Like, I can see it, but it might not show up well on your side. And talking about the chat box, you guys, my chat box isn't opening. So let me just find it first. Sorry, I'm not sharing my screen right now. There we go. My chat box wasn't opening. Now it is. Moving it to my other monitor. So you guys, if you don't mind answering this question in the chat box. So your office sees primarily seniors. You don't have a lot of experience yet. Functionally independent older adults are what? This was on the last exam for dental assisting students, actually. Not saying that it's not going to be for hygiene students, because you never know. And I do feel this is a fair question. So what do you guys think? And please let me know if I need to change the color of this, because it is kind of a light blue. I can see it, but I just want to make sure that everybody else can. So yes, that's a good question. So it's kind of a vague question, but always remember to pick out the keywords. So you would have to know this very, I guess, simple term. So what does this mean? Even if you're not sure, you guys, think of the English language. Even if English isn't your first language, that probably doesn't help you. But think, okay, I don't know what this means, but if if an older adult is independent functionally, well, what might that mean? You are probably thinking, well, they're able to function on their own, right? I'm just taking a guess. Like, that's probably what you're thinking, right? But those aren't the answers, are they? So then you have to do your critical thinking, and we talk about this a lot. You do your critical thinking and say, okay, could it be A, so have more natural teeth? Well, maybe. Could it be B, they have at least one partial denture in the mouth? Think about it. What would that have to do with an adult being able to function? I mean, if you really think about it, I guess it could have something to do with it, because if they're missing teeth and they can't eat properly, well, they should have a partial denture. So, okay, so maybe they have dementia. Well, I wouldn't say they can function well. They can up to a certain point. So you might be thinking, okay, C might not be the right answer. And then the last one, they do not floss. Well, that just has nothing to do with anything. I mean, it does, but look at all of the other answers. That's completely different. So D could be the right answer because it does stick out, or it could be the wrong one because it's completely different. So then you have to go back and say, okay, an independent adult that functions. Well, I would not say right away that they don't floss. So sorry if that sounds confusing, but I like to pick apart each of the answers for you. I'm kind of training you guys over time for those critical thinking. If you're a new student, this will be very confusing, but the more you kind of hear me pick apart all of the answers, you will kind of be able to read my mind and then think, okay, now I know what she will say. And that will help train you to answer those questions for the board exam. Okay, so you're all probably wondering, okay, what's the right answer? A is the right answer, and I'll tell you why this is the right one. Because if they say in your textbook that a senior that is independent and can function, they probably have more natural teeth. That's it. Like, that's the easiest, I guess, most straight definition than ever. A lot of you guys got that correct. Maybe just one person got it wrong. But what do you guys think? Any questions about that, or does that make sense? Daisy, hello. Yeah? Okay, good, good, good. Okay. Your next patient is 86. He's not very independent. Uh-oh. What do you expect to see inside his mouth, even without looking at the chart? So this is as vague as it gets, but that's what the board exam does sometimes, is they have vague questions and very specific answers. So what do you guys think the answer is? And this is good to kind of help to train you guys for the real world too. It just kind of helps you guys prepare. Like even when I see patients, I go through the medical history and like everything first, like their medical history, their dental history first. So I kind of have an idea of what to expect. Good, you guys, not bad. You're actually pretty fast. I think most of you guys did pick this answer. So you would expect that he would have a combination of things. Now, these answers aren't wrong by any means, but you just always have to pick the best one. So for A, always think about it this way. If in the question it's talking about somebody not being very independent, he's probably lost or losing his natural teeth, because if he can't brush himself, unless it mentions he has a caregiver who's able to do it for him like 3 times a day, he will lose his teeth. I see it all the time. The second one, this is just simply the most correct, because also think about his age, 86. If he's losing his teeth, if he's still seeing a dentist, they would have said, okay, it's time to get a partial. There will be a mix of things in his mouth. If this was a completely different question and it was something like your patient is age 20, they're a college student, what do you expect to see in their mouth? You would not expect to see, oh, well, they have like crowns, they have all kinds of things. You would not expect that at somebody so young. The correct answer would not also be, well, you would expect to see most of their natural teeth, because that's kind of obvious. So you always have to pick apart what the question's asking. Okay, for this question, so C, you would not expect to see implants on an 86-year-old. He might have had them placed years ago. Yes, that's not the wrong answer, but you would not expect to see that, especially now. We're still not seeing a lot of implants. It's getting better, but we're just not seeing that all the time. Excellent oral hygiene is not the right answer for sure, because if he's 86, he's getting older, but more so he's not very independent. He would not be able to really have good oral hygiene. So I just left a side note here, because I remember from one of my sessions, it can be hard if English isn't your first language to kind of pick apart some of these words. So I just sort of put that in here for you. Any questions though, you guys, about that so far? Yes, you guys, we should be done around 11 o'clock today. So I won't take too much of your time, I promise. Okay, guys, so what about this one? You are the main dental assistant of the practice. What role does the dental assistant have with a medically and physically compromised patient? Definitely read all of these answers, because it's kind of a trickier one. Yes, don't worry. I know this is a trickier one, so take your time. I'm going to give you guys a minute. Don't worry. I'm not going to rush you guys, because that wouldn't be very nice, would it? Yes, I will be in Woodstock, Stratford, and London this weekend. I know, busy, eh, you guys? There's not a lot of people who clean teeth in their own home, or who go to other people's homes. So it is a service that people definitely want, especially now. They kind of want to stay away from like the outside world. So they're okay to stay in their homes. Okay, you guys are doing awesome. Even for those of you who changed your answer, most of you, good job. Okay, let's talk about it. So C is the best answer. Does anybody have any questions? Because you guys actually did well with this one. I don't think I can explain it any better. Let's see. Just basically think, I mean, they're all not bad, but a lot of them are wrong, right? Like, sorry, I should have brought some water. Excuse me. A would not be correct because the assistant does not help with the probing measurements. Let's see. B isn't wrong, but it's just not the better answer, right? Um, C is just simply the better answer because especially when it comes to a patient with needs of some kind, you will likely be talking to the family more so to let them know what's happening and to make the patient more comfortable. D isn't really wrong, but that's not the best answer. The assistant might help with this, but they don't usually help the dental hygienist pass the instruments. So this is more of a wrong answer. But is everybody okay with that though? Because a lot of you guys did get this right, but I just want to make sure that these answers aren't confusing for you. Okay, good. Next one. So you work in public health and you're looking at some statistics. What is, oh, this is a good one. What is the fastest growing segment of the population? This is in the Mosby. So this is a dental hygiene type of question. And Sam, sorry, I just saw your comment here. You know, it's tricky for mobile. So Sam is just asking if a mobile services could be offered in the States. Every state is different. I hate to say that to you, but it's so true. So in some areas, yes, in some areas, no. So check with your dental hygiene association and they will be able to let you know. Thankfully, where I am, yes, I can. So thankfully, oh my God, I'm so happy. I think we've been able to have our own business since 2007, I want to say. Actually, yes, because that's when I first started dental hygiene school. For those of you who didn't know, I took the program twice because my first college shut down. Yes, it did. 3 weeks before we were supposed to graduate. So I took it again right away. I moved to Toronto for 2 years and took the program again. So no, I did not fail. It was because my school shut down. That's not allowed to happen anymore. So what do you guys think about this one? Yeah, that probably doesn't help you too much, but I don't want, because I don't know every state and kind of what they're allowed to do. So just to be safe, you should ask. Because it's kind of like here in Canada, we're not allowed to give local anesthetic, but in some area, but in the States, I think you can as a dental hygienist, but maybe not all of them. So things are so confusing. Okay, you guys, sorry, moving on. So yes, C is the best answer. You know, don't feel bad if you didn't know this one because this isn't something you would probably think to memorize, but now you must know it, okay? Because they might have this on the exam for hygiene or assisting. This is a fair question. Oh, okay, yeah. So in the States, you can't give local anesthetic for the most part, but in 4 states you can. Okay, so I must be thinking of somewhere else where you pretty much can everywhere, but there's a few areas that don't. But see, it's so hard to keep track, eh? Like honestly. But I'm glad I don't have to give local because I wouldn't do that. That's way too, like you can pay me, sure, 3 times as much if you want me to give local, because that's a lot of responsibility. Ugh, no thanks. Plus, I don't like needles. I know, it's true. Okay, next question. So the most commonly reported oral health related conditions that affect the aging population are, what do you guys think? So this is more seniors than special needs, but it will change. What do you guys think? I know this is a tricky one because they all kind of sound correct, don't they? Except for maybe one of them would be, I would say, a stronger wrong answer. I'll give you guys another minute to think about it. Yes, our next few sessions will be in the evening time. So thank you guys for hopping on nice and early today. This one was actually supposed to be the evening time, but just things, I thought today was like Wednesday or sorry, I thought yesterday was Wednesday, today Thursday. So things got all messed up, totally my fault, but I will not be home. So and where I am, the internet connection is not very good. I thought about tutoring from where I'll be, but the internet connection's horrible, and I don't want to have you not be able to see me, hear me, something like that. So just to be safe. You guys are doing great today. So yes, so this is the most correct answer, okay? It's the most common. Xerostomia and oral cancer isn't wrong, but it's just not the most common. Perio is more common than the aging population getting oral cancer. That's just right from, this is another hygiene type of question, so this would be from the Mosbys. Yes, you might have to know this for the exam, but just sort of think dry mouth and perio are the more common things. This might be a question further on, but root caries is also extremely common in the aging population too. So something to also note. Okay, guys, sorry, let me make this bigger for you. You're about to see your first patient of the day, and you can see from the chart that they have a larger tongue, gingival overgrowth and needs extra TLC. They have the most common developmental disorder associated with an extra chromosome. I kind of feel like I made this one too easy for you guys. I'm going to change this in a second. In fact, I'm going to change it right now, but you guys probably heard me anyway. There we go. What do you guys think? I kind of gave you guys the answer. At least I think I did. Everybody's getting it right, so I probably did. But this has been on the board exam before. And this was even something like on my exam, I do remember. Yes, you guys, so C is the best answer. On the board exam, actually, they did put in this person has an extra chromosome. So that's kind of why I put it in the question, but I kind of feel as soon as you see that, you know right away what it is. I'll leave it on this slide, but I took it out of the previous one, okay? Just because I kind of wanted you guys to think a bit. And for those of you who are not here now and you're going to be watching this afterwards, I want to see if you can kind of, kind of figure it out without having that extra chromosome. And now my other dog wants out. Okay, let me change the slide and you guys can think of this question while I let my other dog outside. There, guys, don't mind the pajama pants again. I am seriously so sorry. I did not know I still had them on. I meant to change out of them, and then as soon as I said, hey guys, I'm like, oh my God, I still have my pajama pants on. So embarrassing. Okay, sorry. Okay, so you are seeing a patient where something affects how the information is processed in the brain by altering how nerve cells and their synapses connect and organize. Sorry, my nose is insanely itchy. What is this? I think it's going to be a bad allergy day today. What do you guys think? I know it could be a couple. Could be a couple of them. Oh, my nose, you guys, so itchy. Again, kind of pick out the keywords here. So how the information is processed in the brain, altering nerve cells, and how things are connected and organized. I mean, that may not help you anyway, but think of what you know about each of these, and that might kind of help a little bit. Very good, you guys. For those who changed your answer, you got it right. So yes, you guys, autism. The key word for autism is that the information is processed in the brain a different way, okay? That's not the only condition that does that, but out of all of these, that's just sort of the key word from that. Good, good. Next one, your patient is age 30 and in a wheelchair. She had a car accident 5 years ago that left her in the wheelchair for the rest of her life. She is known to have, so when somebody was not in a wheelchair and then now they are for the rest of their life, what does this mean? What do you guys think? I feel this is an easy question, but I did want it in here just to make sure that we're all on the same page. You guys saw it, which is perfect. So yes, you guys, the only answer is the last one. One of you guys picked A, but that it doesn't really say what happened to cause that, just that she was in a car accident. But having a seizure doesn't usually mean you all of a sudden can't walk. You know, like think of it that way. I mean, anything can happen if it's a large one, but that's just not the first thing you think about. Okay. And it doesn't mean anything else. It just means, okay, now she's considered a special needs patient because you will have to look at that avenue more so. But most of you guys did get that right, so that's perfect. Okay, guys, moving on. Oh, sorry for the big text here. Let me make that smaller. I thought I changed all that last night. There we go. So you've been seeing the same patient for 10 years, and she's always had she has always had Alzheimer's since you've known her. What is this? So think of the direct definition for Alzheimer's disease or condition, or, you know, what do you guys think? I'll give you guys a minute to read it for sure. My light almost fell. Sorry guys, I just moved my monitor a bit and almost caused an accident with my ring light there. Yes, I will give you guys another minute because I know this is a thinker for sure. Don't feel bad if you need an extra minute to answer this, please. That is allowed. What do you guys think? Very good, you guys. Okay. So the best answer is the last one, okay? And this is just because a lot of you guys did pick A, but that makes sense to me because you don't think of this starting to happen in a younger age, right? Like you don't think about that, but it does actually start then. So it doesn't start to happen, it's not the most common in, let's say you're like in your 80s or 90s. It is actually more common to start in the middle ages, and then it just sort of happens from there. But the thing is, when Alzheimer's is starting, you don't really notice it. So that's why a lot of people are kind of confused by this one and kind of say, well, no, it starts when they're much older. Not necessarily. So this is direct from your textbook. This has been on the board exam before. Of course, not this exact question because I don't have the exact questions, but just kind of the feedback that people give me. So definitely know this. So begins in the middle ages, and the mental capacity, like it gets worse and worse from there, okay? With medication, it might slow down the quickness that the disease is going to progress, but it will. Like this person will never be the same again. I see it all the time, unfortunately. Okay, you guys, very good. Make this bigger for you. You have a new patient coming in and they have already mentioned they're pretty anxious for their appointment. During the exam, you notice increased frequency and depth of the respirations. What could this lead to? So this is your typical like medical emergencies type of questions, special needs. Picking out a keyword for you. What do you guys think? So even as you're answering this, make sure you know all of these different conditions. If you don't, like let's say you're looking through the answers and you kind of say, what's hyperventilation again? Stop and look that up. Okay, that's the best way to kind of like study with mock exam questions. I'm not saying you have to do that now, but if you're ever like studying on your own, sorry, my nose is so itchy. These mock exam questions, this is a good way to just sort of like add some different type of study material, if that makes sense, because it's so common for you to be, you know, studying, and then saying, I feel like I have looked at the same things over and over again. This is one way to mix it up. Very good, you guys. I'm impressed. Hyperventilation. That's basically the only one. Well, no, that's not true. This can happen in all of these conditions, actually, but as soon as you hear something like, okay, their breathing is, you know, happening fast and they look intense, this would be the right answer. Does that make sense? I think everybody got that right anyway. Okay, guys, next one. Ooh, let me make this smaller. Heart attack and muscles are damaged by what and what supply? What do you guys think? It's kind of a thinker, so I'll give you guys a moment to answer this. I know, this is a thinker, because even if you know about a heart attack and you know kind of what happens in a heart attack, do you know specifically what is damaged? You might or you might not. So this is kind of good to really know, or to really test you to see if you know your stuff. That's why I love mock exam questions, because you might think you know a chapter, but then if somebody's asking you questions on that chapter that you're not expecting, that will truly tell you if you know it or not. You guys are like pros today. I think everybody got that correct. Yes, so if there's not enough oxygen, um, yes, you would likely have chest pain, but that has nothing to do with what's being, you know, like what's wrong. Does that make sense? Yes? Okay, good. Next one, you guys. Your patient is only 20, but she has low blood pressure. She says that she's not able to get up from the chair too quickly because if she sits up, if she does, or you sit her up too fast, what could happen? This is a very, very common thing, you guys. Extremely common. This actually happens to me too. With anything, like I was picking up something the other day, I forget what it was. I was doing something in the backyard and then I got up too quickly. I was like, whoa, medical emergency about to happen. It happens. What do you guys think? I did try to trick you guys with this one, by the way, so definitely check out the answers. No, there aren't any spelling mistakes. So if that helps you guys change your answer a bit. Okay, so C is the best answer. For those of you guys who picked B, it was simply because there's no such thing as oral static hypotension. It is called orthostatic hypotension. So orthostatic, am I saying that right? Orthostatic hypotension, or is it orostatic hypotension? Oh boy, let me check. Yes, orthostatic hypotension. Okay, good. Sorry, I was just second guessing myself there. This is when somebody has low blood pressure and they basically can't get up too fast. So B would have been correct if I had spelt it right. But at the same time, you guys, that was not the question. It was not what is this term, it is what could happen. So what's happening is C. So C. So that's what's happening. Does that make sense? So always be careful with the question and what the question's asking to really pick apart the right answer. Okay. Next one. After your CPR and first aid course, you learned all about anaphylactic shock. Without appropriate care, what could happen? So pick out the keywords here, you guys. Anaphylactic shock, and okay, without care, so if somebody's having that anaphylactic shock, what could happen? I know, this is a tricky one too. I purposely did tricky questions for you guys because sometimes I think they're too easy and that does not help you. You need tricky questions to really know if you're getting the right answers or not. Although you guys are very fast today, which is great. So yes, so this is the right answer. So think about it this way. If somebody's having an anaphylactic shock, that's why it's called an anaphylactic, because that means if you don't treat them or you don't help them, they could pass away. That is why it's very, very serious. C is not the right answer because, you know, that's not the most, and it's not the question either. We're not asking what is the most common allergy. We're asking what could happen if the anaphylactic shock isn't taken care of. A is correct because they are having a severe allergic reaction, but that's not what's, well, that is what's happening. But what could happen? So always pick apart those keywords. I think everybody got that right anyway, but I just really wanted to make sure. Oh my goodness gracious. You guys, I'm just going to stop sharing my screen for 1 second. I just want to make sure I didn't put your answers in the wrong slides because these are the slides that I just added last night. Sorry guys, 1 sec. Okay, why is this not going down? I'm just making sure I didn't put the answers on the first slide and I did the second one. Okay, sorry. So the rest of them are fine. You guys have probably seen this. Sorry, I'm just changing the color. But you guys probably saw it, but that's okay. I'm still gonna ask the question. Let me share my screen again. My apologies if you guys saw that, but that's okay. Even if you did, try to think, how would you have answered that anyway? So can some heart diseases be treated with a simple and healthy lifestyle? Which is the best answer to that question? What do you guys think? Again, sorry if you guys saw that answer. That was on the wrong slide. That's what happens when you update answers late at night. My chat box went missing again. Where did it go? Oh boy, silly chat box. Ah, there it is. Okay, good, you guys, perfect. So yeah, so A is the best answer, okay? So always remember and tell your patients that if you live a simple, healthy lifestyle, that really helps. It could mean you don't have to go on more medications. Even for patients who are told they have high blood pressure, if they start eating healthy and limit salt, they may not need to go on medications and they may not, you know, have any serious health complications with that. So it's easier said than done. I don't live the healthiest lifestyle ever, working on it, but it's that simple. Okay, good. Where is the heart located? Simple question, but let's see who gets it right. This is directly from your anatomy textbooks, both hygiene and assisting. So it's not as easy as you might think, or it's not hard as you might think. Yes, if you have to go, you guys, that is okay. It's 10:36. We should be done actually around like 10:45. So I did plan out the slides very well. But if you have to go now, we're leaving off on slide 30, which I'm sorry, I should have the slide numbers on here. I've been meaning to do that, but sometimes I just forget. We're leaving off on slide 30, you guys. So if you need to come back and check things out later. Very good, you guys. So it's in the center but slightly to the left, okay? I know it sounds silly, but they have had this on the board exam before, so I just wanted to make sure that everybody knows it in case they do ask it again. To be honest, I think it's a silly question. I don't see why they would ask it, but they have before, so just to be safe. Okay, so this is a good one, you guys. For the oxygen-rich blood then enters the what side of the heart, compromising the left atrium and the ventricle. So where does the oxygen-rich blood enter from? Remember that anatomy image of the heart, which I can come up with that right now for you. Depending, I did go through this last time, maybe a little bit, or the session prior to that. It doesn't necessarily give you the answer, but at least it kind of helps you think of that image. And then you can say, okay, that's starting to remind me of what's happening. So if this helps, it might not, but the answer is kind of there. So where does oxygen-rich blood enter from? The left side of the heart. That's it, you guys. That's all you had to know. So think oxygen-rich blood, left side. That's it. Easy peasy. Something to memorize for sure. Next one, the what side of the heart pumps blood through the aorta to supply tissues throughout the body with oxygen and nutrients. So the other image would have helped you here too. So definitely one to memorize. Even if it's harder to memorize like the questions, I like to say to memorize those like anatomy images so they can help you with the questions. If I was a student, that's what I would do, is I would like memorize those images and then just be able to kind of picture them in my head as I'm answering the questions. But everybody learns differently, so whatever's easier for you. You guys are great today. You're on the ball. Left side, I think a lot of you guys got that right. Perfect. So this one might be an easy one for you. I do hope at this point you would have known this. What are the four valves of the heart? I wonder if I can find a good image for that too. Let's see. I like this one because it has it circled. Actually, I like this one because it just looks nice. So I'll point this out for you guys after. What do you guys think? What is the answer? What are the four valves of the heart? Excuse me again. If you guys have studied special needs and heart conditions specifically, this is definitely something that I would have expected you guys to know. If you haven't had a chance yet, well, this is kind of like a good introduction to it. Yep, you guys are pros today. C is the best answer. You guys are fantastic. Since you guys are here and we're almost done, think of the session that you want me to go over next time. I will be checking the sessions we still have to do, but if a lot of you want like the same one, then I can sort of move it up a bit. So you just let me know. Okay, guys, last question. What does the valve need to function properly? This has been on the exam before, not last time. I would say early 2019 when somebody brought this up to me. For hygiene and assisting. So even if you guys are dental assisting students, a lot of these things you still have to know. I know, not too exciting, huh? Actually, while you guys are doing that, I'm going to quickly look up our YouTube playlist and see kind of what topics we've done this year, and then kind of go from there. I kind of feel like we need a clinical like a clinical topic where we talk about like seeing a patient and the different things that might happen, like through the assessment phase and things like that. But I can always have a look, you guys, and see. You guys are fast today. Awesome. So clearly everybody was on the ball. Any questions though about anything from today? And look at that, it's 10:42. We are making great time. The recording, I'm just going to say this, the recording will be posted for everybody within a couple hours. It's really slow, so it might take a couple hours. And if you guys are in the Prep Academy course, you will have this PowerPoint also. If you're in the Express course, you don't have the full PowerPoint, but you do have full access to this whole recording in a couple hours. So it's pretty much the same thing. It's just you don't have a PowerPoint with it. That is only if you are in the Prep Academy courses. But how are you guys doing? Any questions? So our next session will be next Friday at 5 p.m. 5 p.m. Eastern time, I should say. And you guys did awesome today, so definitely keep up the good work. That's very impressive. If there's not a topic that you guys really need to, have sooner rather than later, I'm going to check sort of the topics that we have gone through this year and get some other ones, of course, to mix things up a little bit. There will be a case studies session coming up where it's just like random case studies. So that one's always fun, but I like to do that kind of in a month maybe, to give you guys a chance to really study first. Thank you guys. You are so welcome anytime. You guys did fantastic today, honestly. Okay, so I will have this up shortly. You guys have a great weekend, and I'll see you guys next Friday at 5 p.m. Eastern time. If you guys have questions though, just feel free to post them in the Facebook group, and then I will answer you guys as quickly as I possibly can. Anytime, you guys. Thank you guys so much. Thank you guys. Bye.